Memedicine Cram Acyanotic Heart Disease, Flashcard Set 21, Congenital Atrial Septal Defect, Hemodynamic Symptom. All right, so let's just cover a little bit of background before we get into the swing of things. Acyanotic heart disease is a group of heart conditions where the blood, oxygenated blood, let's say on the left side of the heart, mixes with deoxygenated blood usually contained in the right side of the heart, okay? And specifically, a congenital atrial septal defect, it's when there's a hole in the wall of the atria, okay? So the atria sit atop the ventricles. So this is the right atrium. And here we see, blood returning from the venous veins of the body into the right side of the heart and being sent out to the lungs. That's the normal flow, but it's really difficult to see here. Just listen to what I'm saying. When there's a hole in the atria, as right here, some of the oxygenated blood that's come and returned from the lungs and is about to be sent through the aorta to the rest of the body is shunted back to the right atrium and mixes with the deoxygenated blood. And long term, what this will cause is hypoxemia. That's an abnormally low concentration of oxygen in the blood. And also hypoxia, not to be confused with hypoxemia. Hypoxia is when there's like low concentrations of oxygen in the tissues, which will ultimately result. So again, congenital atrial septal defect. Well, congenital means you were born with it, and an atrial septal defect means there's like a hole, okay? There's a hole in the wall between the two upper chambers of the heart, as shown here, and the two upper chambers I'll call the atria. And again, if you were present with it from birth, then it's given the term congenital. And small atrial septal defects sometimes close on their own in infancy or in early childhood, but some large atrial septal defects become a major concern if they progress into adulthood, if the person can make it that long without realizing there's some sort of issue, okay? All right, that was way too much information. Just note that this deck of cards can be used to review for the National Council Licensure Examination. All right. A 30-year-old patient with a congenital atrial septal defect has lived with the defect without significant problems up until now. Which of the following is an indication that the patient is becoming hemodynamically symptomatic? Okay. Is it A, bronchoconstriction and wheezing? Is it B, exertional dyspnea? C, intermittent claudication? Or D, a blood pressure of 140/90? I'll give you a moment to select the correct indication. All right? Okay, so let's analyze each possible indication. First, let's note what hemodynamics means, just in case you forgot or you're wondering. This term, well, the term hemodynamic just refers to the flow of blood through the vessels or the organs and tissues of our body, okay? So bronchoconstriction and wheezing is caused by constriction of bronchial smooth muscle and is not necessarily a hemodynamic symptom related to blood flow. Intermittent claudication. Well, first of all, claudication is a condition in which there's a cramping pain in the leg, often induced by exercise, and typically caused by obstruction of arteries. This is hemodynamic in nature, but it's related to arterial blood flow and skeletal muscle. So it may not be exactly what we're looking for, okay? But because blood, again, is shunted from the left side of the heart to the right side, which I showed you in the opening title card, pulmonary flow is thus increased to the lungs, okay? And the pulmonary arteries become enlarged, and increased pulmonary pressure can result in pulmonary edema, too much fluid in the lungs, which interferes with gas exchange, so there's maybe a buildup of carbon dioxide or a decrease in the oxygen in the blood, especially when the patient is active. So the best choice wouldn't be intermittent claudication nor a blood pressure of 140/90, but it would be exertional dyspnea. And dyspnea is abnormal or uncomfortable breathing. And it has several causes. And a congenital atrial septal defect can definitely cause dyspnea. Okay? So the correct answer choice or the correct indication is B, exertional dyspnea. Okay?